crazy things in the news this week. I want to talk about the Rob Reiner, Nick Reiner, and of course Rob's wife. Not the death of it. It's tragic. Everybody loves his movies. Big fan. I want to talk about the addiction side, okay? Because Nick, this accused son of double homicide, is an addict, and has been an addict since I think his first rehab trip was at 15. And over the span of his life, he's been to 17 addiction treatment centers. I can probably guess we're talking $50,000-$60,000 a month type places. Okay, so which really is insignificant, but it can actually hurt too because you get a lot of fluff. Let me just put it that way. But the most important part about that is most of these celebrity type rehabs are only 30 days long. 30 days is not enough time. But I want to talk about the family perspective here. He was quoted in an interview talking about his son Nick, where they had finally given up on treatment after 17 times because they kept hearing these professionals, as he put it, people with diplomas on their walls, telling them that Nick was a liar and a manipulator, and I'm sure they presented that in a very diplomatic way, because those are the two primary characteristics of addicts, right? But they were offended by that. Well, what's happening here? Oh, and then they said, well, Nick's the addict. It's his struggle. He needs to tell us what he needs, right? So whatever he tells us, that's what we're going to do. So what you have here is you have a family in denial like no other, and you have an addict that's literally dictating this quote-unquote recovery process, which there is none. We say this all the time. I want you to think about this, especially families. If the addict had the capacity to solve this problem, they would have done it already. If the family dynamic had the capacity to solve the addiction problem, you would have done it already. That's not an attack. That's not an offense. Families can't go out and solve cancer either. When you stop looking at addiction as a moral behavior or moral issue, a bad behavioral issue, even though that is a primary characteristic, and you start treating it as a disease with an immense amount of literature, we know exactly what's going on in the brain now, which means we have a solution. But families and addicts, if you really want a different life, you've got to live in the solution. The addict doesn't have the solution. The addict needs to learn the solution. And that takes time. Remember, it takes 12 to 18 months for the brain to heal. So if you're just going in and out of these little 30-day programs, dun, 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 and then getting back to work, getting a new car, getting a new girlfriend, new boyfriend, and then just repeating that cycle, you're not going to change. That's not the professional's fault, right? That's like if you had cancer and they said, okay, it's going to take about 6 months. We've got all these treatments lined up. We want you to go to this support group. You're going to meet with these 3 different professionals. We would do it, right? We'd be like, well, yeah, because I don't want to die. But when it comes to addiction, see, we have a different perspective on addiction because the primary characteristic of addiction is such bad behavior. So even though we may say, oh, no, I know, I understand it's addiction, we still think of it as a moral issue. And if they would just get their head out of their butt, then we could all get back to normal. If we could just take away all their stress, right, as families, if we could just pay all their bills, set them up in a new apartment, get their car fixed, help them get a new car, surely then they'll be able to fly. With a rational brain, that would work. We're not dealing with a rational brain. We're dealing with a disease addict brain. And so you got to start listening to the professionals. Okay, I'm so sorry what's happened to Rob and his wife. That's such a shame. And I'm sorry what's happened to Nick because he didn't have to get this far. He didn't have to progress this far. But it is a good example of what it looks like when families are in denial. They're going to solve this problem on their own. You wouldn't treat your family member who had cancer, right? If you had a family member who had leukemia, you wouldn't all get together and go, okay, well, you're the patient. Tell us what you need. No, we'd go, well, shoot, we need some expertise, and then we would follow it. There's an old saying, and I'll leave you with this. It's a fool who pays for advice and doesn't take it. This is Dr. Miles at Justin's Lighthouse, and I'm signing out.